Hello, my name is Dr. Jose Luis Ruiz and I'm the director of the Los Angeles Institute of Clinical Dentistry. And on this technique of the week, I want to share with you a technique that I've been using in my practice for well over a decade. And I believe that this could dramatically simplify your practice. It would make the life of your patients a lot happier and actually would make you faster. And I'm talking about using a subperiosteal technique for anesthesia. I know this sounds very simple, but it really is. It really is simple and it works like a charm. Let me tell you what I like to do, and take a look at the slide on your screen where you will see in the mandible, as we all know, we have the mucogingival line, and the mucogingival line is where the anesthesia is going to be placed. I like to use articaine. Articaine is a very powerful anesthetic, as you know. It acts faster, deeper, and it is my favorite anesthetic for this particular situation. I will use this technique to anesthetize my patients for any procedure in the mandible with and any tooth as well, including second molars, including third molars. And basically the procedure will be, I will place a little anesthetic in the mucosa right below the tooth that I'm going to be working on. And I usually will place about a third of the carpule very slowly, very carefully, because as we all know, patients don't want to feel that injection. And a good painless anesthesia technique is always very good for our practice. Then, as you can see on the screen, after I have placed that first 1/3 carpule in right below the mucogingival line and the mucosa, very slowly again, then I will go right into the mucogingival line, right below the papilla, the distal papilla of the tooth that I want to anesthetize. And I will start injecting, and I will go all the way into bone, trying to engage the subperiosteum. Then I will start placing my anesthesia. I will be the intention will be to place 1/3 of the carpule in that area, and as you can see on the screen, you will start seeing blanching. Of course, the goal, you will see blanching, and it's okay, it's normal, this is to be expected. We do not want to see extreme blanching. We still want to see some pink, because if we blanch too much, we will cut the nourishment of those tissues, and then the patient will have pain afterwards and some damage to the tissue. So we don't want to do that. So we will be looking at that and make sure that it will blanch, but not too much. Then after placing 1/3 of the carpule on the distal area, I will go into the mesial and will place the final 1/3 of our carpule. And again, I will see the blanching. In this particular example, I was actually working on 2 teeth, so you see me inject anesthesia in 3 different areas, right below the papilla, but the injection goes straight into the mucogingival line. I personally use the regular syringe, but you can certainly consider using a Ligamojet machine, and it works excellent. I encourage you to try that. You will see that it works every time, and I can tell you that literally in my practice I haven't blocked in a decade or more. I use this for every single procedure. Give it a try. I can tell you this is going to make your practice faster, more enjoyable, and your patients are going to be happier with that than they will be with a block, as we all know blocks are painful. I hope you enjoy this clinical tip of the week. We look forward to see you again next week to share with you some of the techniques that I believe will be of value. Have a great day, and I'll see you next time.